Hello, everyone, and welcome to this special episode of Big Idea. We are delighted to welcome Dr. Upendra Kaul, Chairman and Dean, Academics and Research at Batra Hospital and Medical Research Center, New Delhi. A distinguished cardiologist and Padma Shri awardee, Dr. Kaul has been at the forefront of advancing cardiovascular medicine in India. With decades of contribution in clinical practice, teaching, and research, his insights continue to shape the nation's approach to preventive and interventional cardiology. Dr. Kaul, thank you so much for joining us. It's been a pleasure to have you.
Thank you for the invitation.
Sir, to start with, how do you view the current state of cardiovascular health in India, and are we doing enough to recognize it as a national priority?
Cardiovascular problems in this country, as everybody knows, are enormous. And non-communicable diseases, which are, at the forefront after we have, sorted out most of the communicable diseases. The vascular events, cardiovascular events, strokes, these are the major problems. And these are unfortunately not coming under control. In fact, every year we see hike in the number of patients dying of myocardial infarction, strokes, and all the complications because of that. And this is coupled with, aging process. Now we have younger people, we have older people. The average age has increased, longevity has gone beyond 65, 70 years. So the diseases of the elderly are there, but we are having, cardiovascular problems 1 decade before what, you see in the West. So late 30s and 40s, we have so many patients with these problems. And that is because I think the awareness of the major risk factors is lacking in the masses. At the same time, having 1.2 billion population and, with large number of them living in remote areas and villages where the media doesn't reach so far. So these problems like hypertension, high blood pressure is present, in more than 1/3 of the patients. Maybe 30 to 35 to 40% of our adult population has high blood pressure. And the recognition is poor. The treatment to goals is improper. Diabetes, 11%, 10 to 11% of our population has diabetes. Once again, the recognition is delayed till the time the person gets a complication of diabetes. He is not aware of it. Routine checkups at younger ages are much lower than what it should be. So unless you know the population of high BP, diabetes, obesity is at an increase, everybody talks about it, even the Prime Minister talks about it, 10%, 20% tel khana kam kariye. So all those major things plus rapid urbanization, people because of, to get jobs and other things moving to cities, overcrowding, pollution, all this leading to a major hike in the cardiovascular diseases. Facilities to treat them are increasing, but they are not keeping in, line with the numbers required. Insurance for people is scanty, and those who get insured, they get insured then after they have already had a problem. And schemes are coming up, this Ayushman and other things are coming up, but I think much more needs to be done. And future seems to be bright the way new schemes are coming.
Right.
But the problem is there and it has to be recognized. And I think media and this kind of meetings which you are attending today are, crucial and critical for this.
Okay. So, sir, I have a follow-up question for this. So, how can we spread awareness regarding the regular checkups and early screening of these diseases like diabetes and all?
I think it has to start from the schools, colleges. I think school is the best because the school education, the literacy rate is increasing. Children do go to school. Most of the children go to school to catch them between 5 and 15 years of age. And that is the stage. Like I am involved with an NGO called Gauri Kaul Foundation in Kashmir. We have chosen 3 districts and we're going sequentially to schools and trying to find out obesity, catch it there, and also trying to find out by echocardiograms with a mobile unit, portable unit, trying to find out birth defects, rheumatic heart disease, and that's how you can catch them. And similarly, teaching the school teachers, teaching their parents that what kind of food they should be eating. The tuck shops or the places in the school where these things are sold, eating things are sold, should be, keeping heart healthy things rather than chips and other things which are not so good. So it has to start from that stage. And then at the time when you get into the employment, whatever kind of employment is there, because everybody is seeking employment and we have, shortage of jobs, but at the same time, people do get jobs. At that stage, if you have a medical checkup, it doesn't need a very elaborate checkup. A blood pressure, a blood sugar. If the blood pressure is very good, then he doesn't have to worry about it for a year or so. But if the blood pressure is borderline, somebody has a blood pressure of 140, 150, it should be checked again. So that's how you'll pick up. So everybody should be told that you remember the size of your collar, you know what is the size of your shoe. Similarly, you should be knowing what is your blood pressure, what is your blood sugar, which is very simple. If you do such simple things also, you're going to, what is your weight, what should be the ideal weight. So if you make them aware, I don't say that everybody will fall in line, but at least you have conveyed a message that you are overweight. Your body mass index is more than 25, you're overweight. You're more than 30, you're obese, and obesity is associated with this problem. So I think awareness has to be built at various stages, starting early.
So basically, adding small things in your habits, regular checkups, regular that your sugar घर पे ही चेक हो जाती है तो वो कर सकते हैं हम instead of depending upon the doctors we can do that.
That's right. And everybody, in a big family, joint family, we still have joint families, majority. And one of the elderly relations is hypertensive, high BP. बीपी मशीन भी पड़ी होती है बट स्टिल सब लोग नहीं चेक करते
Yes.
तो उसमें तो कोई मुश्किल ही नहीं है ना.
So sir, moving on to my next question, for patients living with obstructive HCM, how does this condition affect their everyday life?
Obstructive, you asked a very specific question.
Yes.
HCM means hypertrophic cardiomyopathy, means that the heart muscle has become thick and there is no other obvious cause for it. Patient doesn't have high BP, patient doesn't have any valve disease which can lead to thick heart muscle. And this is a common problem, but at the same time, very poorly recognized. It is estimated that 1 in 250 healthy people may have HCM. And some studies say if not 1 in 250, at least one in 500. And that means a large number. And very often it presents early without symptoms or the symptoms are vague. So a suspicion has to be there. And whenever there is a suspicion, you have to get a echocardiography done, and which can clinch the diagnosis. The thickness of the muscle, if it is more than 1.5 centimeters, or getting more technical, if the septum is thicker than the posterior wall. So, because if it is asymptomatic today, most of them get into problems over a variable period of time. Some of them develop heart failure, some of them develop episodes of unconsciousness, what we call a syncope. Some of them is also a cause of sudden cardiac death, especially in younger people. Family history, genetic studies, many of these have abnormal genomes, and you can, if there is a person who has been picked up with hypertrophic cardiomyopathy in a young age, screen the family. You're going to bound to find more people totally asymptomatic but with abnormal echoes.
Okay.
And if you recognize it early, guide them. And there are some simple drugs also which help. Things like metoprolol, beta blockers, which are very often used. And there are many other advances in the in this field. And about 60 to 70% of them have obstruction, which you started with hypertrophic obstructive cardiomyopathy. They develop a pressure difference between the heart chamber and its outlet. and that is more severe. And some people do not have this pressure difference at rest, but there are provocative measures to do it. In short, if you have suspicion, they should be referred to a specialized center where an echo can be done. And if you pick it up early, the management becomes simpler and the long term prognosis becomes better. And then you have some very high risk individuals. Hypertrophy beyond 3 centimeters, very thick, cavity size very small. These are the patients who develop or prone to sudden death. And these patients should be given devices or implantable defibrillators which can be life saving, especially in a young person suddenly dying. That is very catastrophic. And there is, as I told you, that it is under recognized, and we have many of them where we don't know. So suspicion is most important. You suspect it and go on a particular clinical algorithm.
As you have mentioned that a large number of heart attacks occur without any warning. So how can we encourage people to go for that regular checkup, or they can identify that their heart is at risk?
Once again, you see, 9 risk factors. 9 risk factors explain 90% of heart attacks. And those 9 risk factors is number 1 is high cholesterol level, bad cholesterol level being high. Number 2 is smoking, which continues till I think 20 to 30% of the population are smokers. Number 3 is high BP. Number 4 is diabetes. Number 5 is overweight. And stress, stress at home, stress at work. And then there are some risk factors like eating less amount of fruits and vegetables. Normally one should be taking 3 to 4 servings. That becomes a risk factor. And not exerting enough, lack of exercise.
Okay.
So these are the 8 risk factors. 9th one is questionable. It used to be said that consuming small amount of alcohol protects the heart, but that's gone away. In fact, WHO now says that even 1 drop of alcohol is bad. So at least these 8 risk factors explain 90%. So if you make the people aware how many of you have these risk factors, and they are not 1 plus 1 becomes 2, they are additive. If you're hypertensive, a person with a high BP is a diabetic also. It's very high risk for a heart attack. And he starts smoking also. He's bound to develop a heart attack sooner or later. So I think recognition of these risk factors has to be promoted as often as you can promote it at all levels.
Okay, sir. So, sir, I'll move on to my next segment, which is the rapid fire round. I'll ask very short questions and I'll request you to answer in very short and quick way. So, sir, my first question is one healthy habit you swear by.
Exercise.
Okay. And morning walk or gym workout.
Anything. Exercise of any kind.
One food you recommend everyone for a healthy heart.
Fruits, fresh fruits.
Okay. And so any technology in cardiology like AI and remote monitoring, what will you suggest?
I think remote monitoring and AI is very good as long as it is accessible to you and as long as you know how to use it. It's still in the initial phases in the general public.
So, sir, finally, with my last question, what research or innovation in the HCM space you are most optimistic about in for the next 5 years?
I think the new drugs, especially mavacamten, which has come, is a very important drug. Strikes at the root cause of it. The root cause is this drug, when it is administered in a small dose of 5 milligrams per day, acts on it and active actin-myosin coupling is reduced. And that's how the hypertrophy, that thickness of the heart reduces, symptoms come down. And I think this is one of the major breakthroughs. And many of these patients would have required surgery or alcohol septal ablation and all that. That this drug can take care of. I think this is one of the very important drugs. Besides, we have beta blockers which have been there, but not as effective.
So, sir, with this, we came to an end for our episode. Thank you so much for giving your valuable time to us.
Thank you.